Ear infections in dogs, also known as otitis externa, are a common but often overlooked health problem. This condition involves inflammation and infection of the external ear canal, which can cause significant discomfort and even pain for your furry companion if not detected and treated promptly. Recognizing the early signs, understanding the causes, and knowing how to manage and prevent ear infections at home are essential steps in ensuring the health and happiness of your beloved pet. Let's begin by exploring the early warning signs of ear infections in dogs. Dogs cannot tell you when something is wrong, so it's crucial to pay close attention to their behaviors and physical cues. One of the most noticeable signs is frequent scratching of the ears. You may see your dog using its hind leg to scratch at its ear, sometimes with considerable force. This persistent scratching is usually a response to irritation, pain, or itchiness in the ear canal. Another common sign is head shaking or tilting. If you observe your dog shaking its head more frequently or holding its head at a tilt, this may indicate discomfort in one ear. The dog may also rub its ears against furniture, carpets, or the ground in an attempt to relieve itching or irritation. A distinct unpleasant odor coming from the ears can be a strong indicator of infection. This smell may range from mildly musty to intensely foul, depending on the severity of the infection. Along with odor, you might notice abnormal discharge from the ear. This can appear as pus, dark brown or black wax, or an excessive amount of yellowish or reddish fluid. Redness, swelling, and heat in the ear are also signs to watch for. By gently examining the inside of your dog's ear, you may notice that the skin appears inflamed, swollen, or feels unusually warm. Be cautious, as touching an infected ear may cause your dog to react with pain, whimpering, or even growling due to the sensitivity. Changes in behavior can provide additional clues. Dogs suffering from ear infections may appear lethargic, less playful, or uninterested in food. Their general demeanor may shift from lively and curious to withdrawn and irritable. If you observe any of these symptoms, prompt veterinary attention is essential to prevent the condition from worsening. Now, let's discuss the underlying causes of ear infections in dogs. Understanding these causes will help you take preventive measures and address the root of the problem. The most prevalent cause is the overgrowth of bacteria or yeast in the ear canal. These microorganisms thrive in warm, moist environments, which is why dogs with floppy ears or those prone to water exposure are at higher risk. Allergies are another significant contributor. Dogs can develop allergies to certain foods, pollen, dust, or other environmental factors. These allergies often manifest as skin issues, including inflammation of the ear canal. Ear mites, tiny parasitic creatures, can also cause intense itching and secondary infections. Though more common in puppies or neglected dogs, mites can affect any dog and should be treated promptly. Excessive earwax buildup can block the ear canal, trapping moisture and debris, which creates a breeding ground for infection. Some dog breeds, such as poodles or Shih Tzus, have hair growing inside their ears, which can impede airflow and make cleaning more difficult. Foreign objects like grass seeds, plant material, or small debris can sometimes find their way into a dog's ear, causing irritation and infection. Lastly, certain underlying health conditions, such as hormonal imbalances or immune system disorders, can make dogs more susceptible to recurrent ear infections. If you suspect your dog has an ear infection, seeking professional veterinary care is crucial. At the clinic, the veterinarian will start with a general health check and gather a history of your dog's symptoms. A thorough ear examination, often using an otoscope, will allow the vet to inspect the ear canal, check for foreign objects, and assess the severity of the infection. A key step in diagnosis is taking a sample of the ear discharge or wax for microscopic examination. This helps identify whether bacteria, yeast, or mites are present and determines the most effective treatment. Cleaning the ear professionally is vital. The vet will use specialized solutions and tools to remove wax, debris, and discharge, ensuring the medication can reach the infected tissue. Treatment typically includes prescription ear drops containing antibiotics, antifungals, or anti-inflammatory agents as needed. In some cases, oral medications may be necessary, especially if the infection is severe or has spread beyond the ear. If ear mites are detected, specific antiparasitic drugs will be used. The veterinarian will also provide detailed instructions for home care, including how to apply medication and how often to clean your dog's ears. Once treatment begins, diligent home care and prevention are essential to avoid recurrence. Always complete the full course of prescribed medication, even if your dog appears to have recovered. Discontinuing treatment too early can allow the infection to return or become resistant to medication. Routine ear cleaning is a fundamental part of prevention. Use only veterinarian-recommended ear cleaning solutions designed for dogs. Gently apply a few drops into your dog's ear canal. Massage the base of the ear for 20 to 30 seconds to loosen debris, and then use a cotton ball or gauze to wipe away excess fluid and dirt from the outer ear. Avoid using cotton swabs deep inside the ear, as they can push debris further in or damage the eardrum. After bathing or swimming, make sure to thoroughly dry your dog's ears. You can place a soft cotton ball gently in the ear before water activities to minimize moisture entering the canal. Always remove the cotton ball afterward and dry the ears carefully. Regularly inspect your dog's ears for any signs of redness, swelling, or unusual odor. For breeds with lots of hair in their ears, periodic trimming by a groomer or veterinarian can help maintain airflow and cleanliness. Diet plays a role as well, especially for dogs with known allergies. Consult with your veterinarian to select the best food and to identify any ingredients that may trigger allergic reactions. Lastly, schedule regular veterinary checkups at least once or twice a year, even if your dog seems healthy. These visits allow early detection of any potential issues, including ear problems. With the right knowledge, vigilance, and care, ear infections in dogs can be effectively managed and prevented. Protecting your dog's ears is an important part of overall health, ensuring your loyal companion remains happy, comfortable, and full of life for years to come.